Now, if the lesion contains fat, that can help you tell what the thing is as well. So in this case, it's lucent, but you don't know if that's fatty material or that's fibrous tissue, because that could also all appear lucent on a radiograph. But on the MRI, you can see that it's clearly very bright on the T1, and it's fat sat on the T2, and this is in a fat sat T2. This is a person with a intraosseous lipoma. How about this case here? You see a lesion here? Oops. Well, there's a lucent area here, and there's a more sort of dense area here, and there's that very dense dystrophic calcification within the center. On the CT, we see the lucent area here, the dystrophic central calcification, and this relative sort of slightly more higher density material surrounding that. Now here, the MRI, it can be a little bit confusing if you think that the lesion is just this. But really, the lesion is this whole thing here. And that's the fat. That's the fatty part here that you're seeing on the radiograph and the CT. This part is the fluid-containing part that's a little bit brighter than the fat. The dystrophic calcification is in the center there, which we don't see. Now, if you look at the fat sat T2, the tumor here blends in with the normal fat of the bone. And this part here is the low signal here on the T1. And now you see the dystrophic calcification. And so this is a patient with also an intraosseous lipoma. But when the lesions have necrosis, they can have a surrounding area of fluid with the central dystrophic calcification. The other thing that can be helpful for fat is lesions that contain fat, such as hemangiomas. In this case, you see on the T2 fat sat, it's very bright. On the T1, it's also bright. And so this is a person with a hemangioma. Actually, sorry, this is a non-T2 fat sat.